Hello, friends. Welcome back to our Health and Wellness Corner. Today, we are diving into a topic that affects millions of people worldwide: kidney stones. We are here to debunk some common myths and shed light on the facts about this condition. First, let's start at the beginning. Kidney stones are hard deposits of minerals and salts that form inside our kidneys. They can range from the size of a grain of sand to a pearl, and can be quite painful when passing through the urinary tract. Now, you might think you know what causes these troublesome stones, but there's a lot of misinformation out there. So, let's play a game of myth versus fact. Myth number 1. Only older men get kidney stones. Fact. While it's true that kidney stones are more common in men over 40, they can affect people of all ages and genders, even children. Yes, that's right. No one is completely safe from kidney stones. Myth number 2. Drinking milk causes kidney stones. Fact. Contrary to popular belief, a diet low in calcium can actually increase the risk of developing kidney stones. So don't shy away from your dairy, folks. Now, on to myth number 3. If you get a kidney stone once, you'll never get one again. Fact. Unfortunately, once you've had one kidney stone, you're at a higher risk of developing another. Approximately half of people who've had a kidney stone will develop another within 5-7 years if they don't take preventive measures. Myth number 4. Drinking a lot of cranberry juice can prevent kidney stones. Fact. While cranberry juice may be a go-to for urinary tract infections, it doesn't prevent kidney stones. In fact, it may increase the risk of certain types of stones due to its high oxalate content. Myth number 5. Kidney stones are always extremely painful. Fact. While many kidney stones do cause severe pain, smaller stones might pass unnoticed. The severe pain usually occurs when a stone gets stuck and blocks urine flow. Finally, myth number 6. All kidney stones are the same. Fact. There are several types of kidney stones, each with their own composition and appearance. Knowing the type of stone can guide treatment and prevention strategies. So, now that we've busted some myths, what can you do to prevent kidney stones? The answer is simple. Stay well hydrated. Limit your intake of salt and animal protein, and maintain a healthy body weight. And remember, always consult your healthcare provider for advice tailored to your individual needs. That's all for today. Let us know if you've learned something new about kidney stones. And please make sure to share this video with your friends and family. Until next time, stay healthy, stay informed.